The burned-out doctor thought he was treating just another patient in the emergency room, but when this patient started talking about the warrior's approach to healing, Dr. Miller realized something was very different about this man. 20 years of medical practice had made Dr. Miller cold and disconnected until this patient showed him that a true healer must be like water flowing, adapting, never forcing. When the patient finally revealed who he really was, Dr. Miller's world was turned upside down, and what happened next revolutionized not just his approach to medicine, but his entire philosophy of life. It was 2:47 a.m. on a Tuesday night at San Francisco General Hospital, and Dr. James Miller was experiencing what would become the most important shift of his 20-year medical career. The emergency room was buzzing with its usual chaos, ambulances arriving, nurses rushing between curtained areas, the constant beeping of monitors creating a symphony of urgent medical care. But Dr. Miller was numb to it all. At 45 years old, this man who had once dreamed of changing the world through medicine had become a ghost of his former self. His interactions with patients had become mechanical, routine, devoid of the compassion that had once driven him to medical school. Room 314, the nurse called out, handing him a clipboard. New patient, possible concussion from a martial arts demonstration. He's conscious and alert, but insisted on waiting for the attending physician. Dr. Miller took the clipboard without looking up, his eyes scanning the paperwork with the same detached efficiency he'd developed over the past 5 years. James Chen, age 32, brought in after a training accident at a local dojo. Nothing unusual, nothing that would require more than standard protocol. As Dr. Miller walked toward room 314, he had no idea that the next hour would completely transform not just his approach to medicine, but his entire understanding of what it truly meant to heal another human being. He pushed open the door to find a lean, athletic man sitting calmly on the examination table. The patient's posture was unusual, perfectly straight, yet relaxed, as if he was completely at peace, despite being in a hospital emergency room at nearly 3 a.m. "Good evening, doctor," Miller said in his standard, professional tone. "I'm Dr. Miller. Let's take a look at this head injury." The patient looked directly into Dr. Miller's eyes with an intensity that was somehow both penetrating and gentle. "Good evening, doctor. Before we begin, may I ask you something?" Dr. Miller paused, slightly taken aback. Patients didn't usually start their examinations with questions. "I suppose, but let's focus on your medical condition first." "My question is about healing," the patient continued calmly. "In your experience, what is the difference between treating a condition and truly healing a person?" Dr. Miller felt a flicker of irritation. He didn't have time for philosophical discussions, especially not at 3 a.m. "Sir, I need to examine your head injury. We can discuss medical philosophy some other time." But something about the patient's presence made Dr. Miller hesitate. There was a stillness about this man that seemed to slow down the frantic energy of the emergency room. Despite his professional instincts telling him to stick to protocol, Dr. Miller found himself curious about this unexpected question. "Treating and healing are the same thing," Dr. Miller replied curtly, pulling on his examination gloves. "We diagnose the problem, we apply the appropriate medical intervention, and the patient recovers." The patient smiled slightly, and Dr. Miller noticed that even this simple expression seemed to radiate a kind of calm confidence. "I respectfully disagree, doctor. A warrior knows that there is a profound difference between winning a fight and achieving true victory." Dr. Miller stopped what he was doing. "A warrior? Are you comparing medicine to combat?" "In many ways, yes," the patient replied. "Both require strategy, both require understanding your opponent, whether that opponent is an enemy or a disease. But most importantly, both require understanding yourself." As Dr. Miller began his examination, checking the patient's pupils and testing his reflexes, he found himself drawn into this unusual conversation despite his better judgment. There was something about this man's voice, his presence, that seemed to cut through the emotional numbness that had characterized Dr. Miller's recent years. "Your reflexes are normal," Dr. Miller said, making notes on his chart. "No signs of concussion. You should be fine to go home." "Doctor," the patient said, as Dr. Miller was about to leave. "May I share something with you?" Dr. Miller turned back, and for reasons he couldn't explain, he found himself nodding. "I can see that you are carrying a great burden," the patient said softly. "You have been fighting for so long that you have forgotten why you became a warrior in the first place." The words hit Dr. Miller like a physical blow. How could this stranger, this patient he'd known for less than 10 minutes, see so clearly what Dr. Miller had been trying to hide from everyone, including himself? "I don't know what you're talking about, doctor," Miller replied, but his voice lacked conviction. 20 years ago, you entered this profession because you wanted to heal people," the patient continued. "You believed that medicine was a sacred calling, that every patient was a human being deserving of compassion and care. But somewhere along the way, you began to see patients as problems to be solved rather than people to be healed." Dr. Miller felt his professional composure beginning to crack. "You don't know anything about me or my career. I know that you haven't really looked at a patient's face in months," the patient said gently. "I know that you've been going through the motions of medicine without feeling any connection to the people you're treating. I know that you've been wondering if this is all there is, if this mechanical approach to healing is what you're going to do for the rest of your life." The accuracy of these observations was devastating. Dr. Miller felt tears beginning to form in his eyes, an emotional response he hadn't experienced in his professional life for years. "How could you possibly know any of that?" Dr. Miller whispered. "Because I understand what happens when a warrior loses sight of his true purpose," the patient replied. "I have seen many people who were meant to be healers become nothing more than technicians. But I have also seen those same people rediscover their calling when they remember the most important principle of all, which is, be like water, doctor." Dr. Miller stared at this patient, this stranger who seemed to be speaking directly to his soul. "What does that mean?" "Water takes the shape of whatever container it enters, but it never loses its essential nature. Water can be gentle enough to nourish life, or powerful enough to carve canyons through solid rock. Water adapts to every situation, but it never forces its way when it meets resistance." The patient stood up from the examination table and moved to the small window in the room, gazing out at the city lights of San Francisco. "When you first became a doctor, you were like water," he continued. "You adapted to each patient's needs, you flowed around obstacles, you found creative ways to provide healing even in the most difficult circumstances. But over time, you became rigid. You started treating every patient the same way, following the same protocols, expecting the same results." Miller found himself completely absorbed in this conversation. For the first time in years, he felt truly present, truly engaged with another human being. "I've been practicing medicine for 20 years, Dr. Miller said slowly. "I've saved thousands of lives, but lately, I feel like I'm just going through the motions. I don't feel connected to my patients anymore. I don't feel like I'm really helping anyone." "That is because you have forgotten that healing is not something you do to someone," the patient replied. "Healing is something you do with someone. It requires presence, attention, and most importantly, it requires seeing each patient as a complete human being, not just a collection of symptoms." "But we have protocols, procedures, standards of care," Dr. Miller protested. "I can't just make up my own approach for every patient." "I'm not suggesting that you abandon your medical training," the patient said with a smile. "I'm suggesting that you remember that your medical training is a tool, not a prison. A true master knows when to follow the rules and when to adapt them to serve a higher purpose." Dr. Miller felt something shifting inside him, a sense of possibility that he hadn't experienced in years. "Are you a doctor yourself?" "I am a teacher," the patient replied. "I teach people how to discover their own strength, how to overcome obstacles, and how to achieve their highest potential. In many ways, that is exactly what you do as a physician." "I've never thought of it that way. Every patient who comes to you is fighting a battle," the patient continued. "Some are fighting against disease, some against injury, some against fear. Your role is not just to apply medical procedures. Your role is to be their ally in that fight, to help them find the strength they didn't know they had. Dr. Miller sat down in the chair next to the examination table, feeling emotionally exhausted but somehow more awake than he'd felt in months. "Can I tell you something?" Dr. Miller said quietly. "There are days when I don't even want to come to work anymore. I used to love this job, but now it feels like I'm just processing cases, not healing people." "What changed?" the patient asked. Dr. Miller thought for a long moment. "I think I started focusing more on not making mistakes than on making connections. I became so afraid of doing the wrong thing that I stopped trying to do the right thing." "Fear is the enemy of flow," the patient replied. "When you are afraid, you become rigid. When you are rigid, you cannot adapt. When you cannot adapt, you cannot truly serve others." "So how do I get back to who I used to be?" "You don't go back," the patient said firmly. "You go forward. You take all the knowledge and experience you have gained over these 20 years, and you combine it with the compassion and presence you had when you first became a doctor. That combination will make you a more effective healer than you ever imagined possible." The patient moved closer to Dr. Miller, and for the first time, Dr. Miller noticed the extraordinary presence this man radiated. There was something almost magnetic about his confidence, his calm certainty. "Let me show you something," the patient said. "Give me your hand." Dr. Miller extended his hand, and the patient placed his own hand underneath it, palm to palm. "Now try to push my hand down using force." Dr. Miller pushed downward, and the patient's hand resisted with equal force. The harder Dr. Miller pushed, the more resistance he encountered. Now the patient said, "Stop pushing, and simply let your hand flow downward, like water finding its way around an obstacle." Dr. Miller relaxed his hand and let it move naturally. To his surprise, the patient's hand moved with his, offering no resistance, and Dr. Miller's hand moved downward effortlessly. "You see," the patient said, "when you try to force a result, you create resistance. When you flow with the natural movement, you achieve your goal with minimal effort." "What does this have to do with medicine?" "Everything," the patient replied. When you try to force healing on a patient, when you focus only on procedures and protocols, you create resistance. The patient feels like a problem to be solved rather than a person to be helped. But when you flow with each patient's unique needs, when you adapt your approach to their specific situation, healing happens more naturally. Dr. Miller felt a light bulb moment. "You're saying that I should treat each patient as an individual, not just as a case." "Exactly. And more than that, you should remember that healing is a partnership. You provide the medical knowledge and skills, but the patient provides something equally important: their own inner strength, their will to heal, their unique wisdom about their own body." "I never thought about patients as having wisdom about their own healing." "Every person knows their body better than anyone else," the patient explained. "They know what hurts, what feels wrong, what gives them strength. Your job is not just to apply your medical knowledge, but to listen to their wisdom and combine it with your expertise." Dr. Miller stood up and began pacing around the small room. "This is completely different from how I was trained to think about medicine." "How were you trained to think about medicine?" "That the doctor is the expert, the patient is the passive recipient of care, and that medical protocols should be followed exactly as written." "And how has that approach been working for you?" Dr. Miller laughed bitterly. "It's made me miserable, and I think less effective as a doctor." "Then perhaps it's time to try a different approach." "But what if I make mistakes? What if this more intuitive approach leads to worse outcomes for my patients?" The patient smiled. "What if it leads to better outcomes? What if patients heal faster when they feel truly seen and heard? What if your medical interventions are more effective when they're combined with genuine human connection?" "I suppose there's research suggesting that doctor-patient relationships do affect healing outcomes," Dr. Miller admitted. "Of course there is. Healing is not just a physical process, it's also an emotional and spiritual process. When people feel supported, understood, and cared for, their bodies often heal more effectively." Dr. Miller felt a surge of excitement that he hadn't experienced in his medical practice for years. So you're saying that by becoming more present and compassionate with my patients, I might actually become a better doctor, not just a nicer person. I'm saying that true mastery in any field requires both technical skill and human wisdom. You have spent 20 years developing your technical skills. Now it's time to redevelop your human wisdom. How do I do that? Start by making eye contact with your patients. Really look at them as people, not as medical cases. Ask them how they're feeling, not just about their symptoms, but about their experience of being sick or injured. Listen to their answers, not just for medical information, but for clues about how you can best support them. Dr. Miller nodded, feeling more engaged than he had in months. What else? Remember that every patient is someone's beloved family member. Treat them the way you would want your own mother or father or child to be treated. Show them the same respect and compassion you would want your loved ones to receive. That's beautiful advice, but sometimes it's hard to maintain that level of compassion when you're dealing with difficult patients, or when you're exhausted, or when you're overwhelmed with cases. That's when the water principle becomes most important, the patient replied. When you encounter resistance, whether from a difficult patient, from your own fatigue, or from institutional pressures, don't fight against it. Flow around it. Find creative ways to maintain your compassion even in challenging circumstances. Can you give me an example? If you have a patient who is angry or uncooperative, instead of becoming frustrated, try to understand what they're really feeling. Often, anger is just fear in disguise. If you're exhausted, instead of pushing through with caffeine and willpower, take a moment to center yourself, to remember why you became a doctor in the first place. Dr. Miller felt tears welling up in his eyes again. I became a doctor because I wanted to make a difference in people's lives. I wanted to be there for them during their most vulnerable moments. And you can still be that doctor, the patient said gently. You can still make that difference, but you have to choose to do it every day, with every patient, in every interaction. It sounds like you're talking about more than just medical practice. It sounds like you're talking about a way of living. I am. The principles that make someone an excellent healer are the same principles that make someone an excellent human being. Presence, compassion, adaptability, strength combined with gentleness. Dr. Miller looked at this patient with growing amazement. Who are you? How do you know so much about healing and human nature? The patient smiled, and for the first time Dr. Miller noticed something familiar about his facial features, something that seemed almost iconic. My name is Bruce, the patient said quietly. Bruce Lee. Dr. Miller felt his world stop. Bruce Lee, the martial artist, but you're supposed to be dead. Bruce Lee smiled. That's a longer story for another time. But yes, I am Bruce Lee, and everything I've shared with you tonight comes from a lifetime of studying the human potential for growth, strength, and healing. Dr. Miller sat down heavily in his chair, trying to process this revelation. I can't believe this. Bruce Lee is sitting in my emergency room talking to me about medical philosophy. The principles of martial arts and the principles of medicine are not as different as you might think, Bruce Lee said. Both require discipline, both require continuous learning, both require the ability to adapt to changing circumstances, and both are ultimately about helping people become stronger and healthier. But I thought martial arts was about fighting, about defeating opponents. That's a common misconception. True martial arts is about understanding yourself, developing your potential, and learning to live in harmony with the world around you. The physical techniques are just tools for developing these deeper qualities. And you think these qualities apply to medicine? I know they do. A doctor who is present, compassionate, and adaptable will always be more effective than a doctor who simply follows protocols without connecting with patients. Dr. Miller felt his mind racing with possibilities. So when you talk about being like water, you're talking about adapting my medical approach to each individual patient. Exactly. Water doesn't fight against obstacles, it finds a way around them. Water doesn't force its way into containers. It takes the shape that's needed. But water never loses its essential nature, its ability to nourish and sustain life. That's an incredibly powerful metaphor for medical practice. It's more than a metaphor, Bruce Lee replied. It's a practical approach that you can implement starting with your very next patient. Dr. Miller stood up and began pacing again, but this time with energy and excitement rather than anxiety. I feel like you've given me permission to be the doctor I always wanted to be. I haven't given you permission, Bruce Lee said with a smile. You already had that permission. I've simply reminded you that you have choices in how you practice medicine. You can choose to see patients as cases, or you can choose to see them as human beings. You can choose to follow protocols rigidly, or you can choose to adapt your approach to serve each patient's unique needs. But what about my colleagues? What about hospital administration? What if they don't support this more personal approach to patient care? Be like water, Bruce Lee replied. You don't have to announce your new approach or try to convince anyone else to change. Simply start practicing with more presence and compassion. Let your results speak for themselves. When patients respond better to your care, when they heal faster and feel more satisfied with their treatment, others will notice. And if they ask me what I'm doing differently, tell them the truth. Tell them that you're taking time to really see each patient as a human being, that you're listening more carefully to their concerns, that you're adapting your approach to their individual needs. These aren't radical concepts, they're fundamental principles of good medicine that sometimes get lost in the complexity of modern healthcare. Dr. Miller felt a sense of clarity and purpose that he hadn't experienced in years. I feel like I'm remembering who I wanted to be when I first became a doctor. That person is still inside you, Bruce Lee said. You haven't lost your ability to be a great healer, you've simply forgotten how to access it. How do I make sure I don't forget again? Practice presence every day. Before you enter each patient's room, take a moment to center yourself, to remember that you're about to interact with a fellow human being who is experiencing vulnerability and fear. Remind yourself that you have the privilege of being present during one of the most important moments in their life. That's a beautiful way to think about it. And remember that healing is not something you do alone. You are part of a team that includes not just other medical professionals but also the patient themselves, their family members, their support systems. Your job is to coordinate this team in service of the patient's highest good. Dr. Miller felt tears of gratitude flowing down his face. Thank you. I don't know how to express how much this conversation means to me. Express it through your actions, Bruce Lee replied. Express it by being the healer you were meant to be. Express it by treating every patient with the compassion and respect they deserve. I will. I promise I will. Bruce Lee stood up and moved toward the door. I should be going. But before I leave, I want you to remember something very important. What's that? You are not just a doctor. You are a healer. Doctors treat diseases, but healers restore wholeness to human beings. The world needs more healers, and you have the opportunity to be one of them. As Bruce Lee reached for the door handle, Dr. Miller called out, "Wait. Will I see you again?" Bruce Lee turned back with a smile. Every time you look into a patient's eyes with genuine compassion, every time you adapt your approach to serve someone's unique needs, every time you choose presence over protocol, you will be seeing me again. Because those moments are when you become the healer you were always meant to be. And with that, Bruce Lee was gone, leaving Dr. Miller alone in room 314 with a completely transformed understanding of what it meant to practice medicine. Dr. Miller stood in the quiet room for several minutes, processing everything that had just happened. Then he picked up his clipboard and walked back into the emergency room, ready to see his next patient. But this time, everything was different. This time, when the nurse handed him the next case, Dr. Miller took a moment to read not just the medical information but to imagine the human being behind the chart. This time, when he knocked on the door of room 318, he took a deep breath and reminded himself that he was about to meet someone who needed not just medical treatment but human compassion. The patient in room 318 was an elderly woman with chest pain. But instead of immediately launching into his standard cardiac protocol, Dr. Miller sat down beside her bed and made eye contact. "Good morning," he said gently. "I'm Dr. Miller. I can see that you're frightened, and I want you to know that you're in good hands. Can you tell me how you're feeling, both physically and emotionally?" The woman's eyes filled with tears. "I'm scared, doctor. I live alone, and when the chest pain started, I thought I might be having a heart attack. I thought I might die alone." "You're not alone now, doctor," Miller replied, taking her hand. "We're going to take excellent care of you, and we're going to figure out exactly what's causing your chest pain. But first, I want you to know that whatever we discover, we're going to face it together, and we're going to make sure you have all the support you need." As Dr. Miller conducted his examination, he found himself truly present with this patient in a way he hadn't been present with anyone in years. He listened not just to her heart and lungs, but to her fears and concerns. He explained each step of his evaluation in terms she could understand, and he made sure she felt heard and valued throughout the process. By the time Dr. Miller completed his assessment and determined that the woman was experiencing acid reflux rather than a heart attack, something remarkable had happened. Not only had he provided excellent medical care, but he had also given this frightened elderly woman a sense of safety and dignity that she would remember for the rest of her life. And Dr. Miller discovered something that amazed him: this more compassionate, present approach to patient care didn't take longer than his previous mechanical approach. In fact, it seemed to be more efficient, because when patients felt heard and understood, they were more cooperative and more willing to share important information about their symptoms. Over the following weeks, Dr. Miller continued to implement the principles Bruce Lee had taught him. He approached each patient as a unique human being with their own wisdom about their body and their healing process. He practiced being like water, adapting his communication style, his treatment approach, and his bedside manner to serve each patient's individual needs. The results were remarkable. Patient satisfaction scores for Dr. Miller's care improved dramatically. Other staff members began to notice that his patients seemed calmer, more cooperative, and more satisfied with their treatment. Several patients specifically requested to see Dr. Miller when they returned for follow-up care. But perhaps most importantly, Dr. Miller rediscovered his love for medicine. He began looking forward to coming to work, eager to connect with patients and to make a positive difference in their lives. The emotional numbness that had characterized his recent years was replaced by a sense of purpose and fulfillment that reminded him why he had chosen to become a doctor in the first place. 6 months after his encounter with Bruce Lee, Dr. Miller was asked to speak at a medical conference about his approach to patient care. He titled his presentation "The Water Principle: Adapting Medical Practice to Serve Human Needs." In his presentation, Dr. Miller shared the story of how a conversation with an unusual patient had transformed his understanding of what it meant to be a healer. He explained the concept of being like water in medical practice, maintaining one's essential nature as a compassionate healer while adapting one's approach to meet each patient's unique needs. The response to his presentation was overwhelming. Doctors from around the country reached out to learn more about his approach. Medical schools began inviting him to speak to students about the importance of maintaining humanity in medical practice. But Dr. Miller never forgot the source of his transformation. In his office, he kept a small sign that read "Be like water," and before seeing each patient, he would glance at this reminder of the wisdom Bruce Lee had shared with him on that early morning in room 314. Years later, when colleagues asked Dr. Miller what had changed his approach to medicine so dramatically, he would smile and say, "I learned that true healing requires both medical expertise and human wisdom. When you combine technical skill with genuine compassion, you become not just a doctor but a healer." The impact of Bruce Lee's teachings extended far beyond Dr. Miller's individual practice. As other physicians learned about his approach and began implementing similar principles, a quiet revolution began to take place in healthcare, a return to the fundamental understanding that healing is ultimately about human connection, and that the most advanced medical technology in the world cannot replace the power of one human being truly seeing and caring for another. And somewhere in the space between medical protocols and human compassion, Bruce Lee's wisdom continued to flow like water, touching the lives of healers and patients alike, reminding everyone that the greatest medicine is not found in any pharmacy, but in the infinite capacity of human beings to care for one another with presence, respect, and love. This is the story of how a burned-out doctor rediscovered his calling, how a chance encounter with a martial arts master revolutionized an approach to healing, and how the simple principle of being like water transformed not just one medical practice, but an entire understanding of what it truly means to heal.